Okay.
Yes.
Now, most of the guests, when I bring them on, I start through trauma, but we go in many ways, and I always ask them, "What's your definition?
Yeah.
What is trauma?"
Yeah. Well, as it's defined in the Diagnostic and Statistic Manual, right? The DSM, our kind of Bible
I've
of
heard of it. Yes.
diagnoses. Yes. As it's defined there, it's exposure to actual or threatened death, serious injury, or sexual violence. So either by experiencing it directly, by witnessing it, or by learning that it's occurred to somebody close to you.
Um, and is that closely related to PTSD? I was asking someone before.
Yeah.
So the trauma is the event, and the PTSD
Yes.
is what you suffer from after it.
Yes. Yes. So PTSD, post traumatic stress disorder, is a diagnostic label that was entered in the DSM in 1980. So PTSD as a diagnosis, it was really meant to capture it's like a constellation of symptoms, right? That's meant to capture like things are going okay, then something really bad happens. All of a sudden, I'm not so okay anymore, right? I'm having memories coming out of nowhere, intrusive thoughts. I can't stop thinking about the event. I'm having trouble sleeping. My mood's all kind of out of whack, right? So this kind of constellation of symptoms is PTSD. But the first criteria actually, it's pretty interesting because for the DSM, most disorders don't have like an external criteria, right? It's all about what's going on internally inside. But for PTSD, the first criteria is having experienced a trauma, which is defined by, as I said, right, actual exposure to actual or threatened um, death or serious injury.